As Don mentioned, I'm Rachel Brown. I'm a family physician. I'm the medical director for health and wellness at Palmetto Health in Columbia, and also the chair of the Resilience Advisory Council. And so I have the privilege of working with the teams that are in charge of designing the programs for all of our team members at Palmetto Health, all of our employees at Palmetto Health. And my special passion is working with care providers around burnout and trying to build resilience. So as Ms. Alexander did a great job of pointing out, this is a big, big, big problem in healthcare. And it's a huge problem for physicians. It's a huge problem for all healthcare providers. In fact, anyone who works in any kind of healthcare institution is at risk. So we're even talking about the greeters at the door, the folks that work in our cafeterias, our EBS folks. It's everyone who's impacted by this. So I'm phenomenally passionate. Now, let me just say that I completely understand that I can take you and tank you up individually. I can teach you all kinds of ways for you to build your individual resilience, or teach you ways for you to teach others how to build their individual resilience. And if I throw you back in a toxic environment, it's only going to last for a little while. I completely understand that. So, but what I'm doing is addressing those two blue wedges that we do have a little bit of control over, right? And so that's what I'm here to do today. And what I'd also like to sneak in a little of is how you can scale this up at a work unit level, so that it isn't just you working on your personal resilience, but that you're actually beginning to instill the priority of tending to well-being in the culture of your work unit, which is kind of the best we can do in terms of addressing these issues immediately. It's a bit of a temporizing measure. So we'll start with the fact that I have no disclosures. I already mentioned what our learning objectives are today. They're very similar to what Ms. Alexander talked about, except we're going to be talking about what you can do on a personal level. So now that you know what burnout is, and you should know that at any given point in time in an organization, about 2/3 of the people in that healthcare organization are experiencing symptoms of burnout. So when you think about bringing a loved one or yourself to that healthcare system and knowing that 2/3 of those folks are sort of about what they're doing, that needs to be addressed. And one thing that we didn't talk about was the personal life impact of burnout. So we looked a lot at how it impacts quality. And it doesn't matter how well you think you're doing, if you're burnout, you really are not providing the quality of care that our patients need and that we know you can provide. We know what it does to cost, we know what it does to turnover, but when I get up in the morning, what really drives me to do the work that I do is that we know what it does to your personal life. Folks who are burnout have higher rates of divorce, they have higher rates of physical and emotional health problems, they have higher rates of substance abuse, accidents, and that's when I say unacceptable, because it's bad enough if it's impacting your career, but when it's impacting your personal life, we have to say no. One more fact before we move on to some of the tools. Over a physician's lifetime, there is a 99.3% chance that you will become burnout. So everybody in this room, if you haven't already been through burnout, you're headed for it. And I don't know about you, but if someone told me 100% of my patients were going to come to me with Lyme disease at some point, 100% of them, I would be doing everything I could to figure out how to prevent Lyme disease. So we need to, and thank you, ma'am, need to be looking at how we prevent burnout in physicians, because it's almost a guarantee that you will go through it. Now I'm looking around the room and I see longevity. That's how I'm going to put that. I see longevity. And so a lot of you in this room have already figured out how to get through this, right? And let's face it, physicians are highly resilient people. We didn't do what we do because we aren't resilient. But times are changing, and we are having to adapt, and we all need to tend to our well-being. And even if you are what I like to call lovingly a positive deviant, and you're very, very resilient, and you've always been one that can just slog through the work, you can help others by what you're about to learn. You can mentor for others who might be struggling with this, okay? So I'm going to start by talking to you about two overarching concepts around personal resilience that have come out in the literature. The first one revolves around these 8 dimensions, these 8 wellness dimensions. So in the literature, it's highly recognized that we have 8 areas of wellness that contribute to our happiness, our joy in life, our purpose in life, and our overall resilience. So what I'd like you guys to do as I read them is to think in your mind, how am I doing in this area? Have I got this one down? Or maybe I could do a little bit more in this particular area. So we have emotional wellness, which is a lot about what we're talking about today. How resilient are we? And I should mention resilience is literally just coping with stressors, right? So if you came today wondering how I could help you not have stress in your life, then I'm sorry, I'm going to let you down. Because there's no way I can eliminate stress. We're in healthcare. That's our fault. We signed up for that. We have to deal with the stress of that. Resilience is what do we do to build coping mechanisms to deal with that stress. And that's emotional wellness. Financial wellness, I also cannot help you with. But if we have any medical students or trainees in the audience, I promise you it does get better. We got to take stock there. We have to feel secure in our finances. Social wellness is the connection we have with others. And by the way, this does not have to be at work. We do not have to be tight with everybody at work. But everyone has to have some kind of connection, or they are not going to feel whole and well. So that might be family, friends, church groups, hobby groups, whatever. We've got spiritual wellness. Now, this is often faith-based, but it does not have to be. This is really looking at, do you know and think you're living your meaning and purpose in your life? Do you feel like you know what your purpose is, and are you living that? Physical wellness is what everybody at the hospital thinks I do, that I chase them around and make sure that they get 150 minutes of exercise every week and only eat salmon and asparagus. And I do a little of that, but that's how well do we take care of our bodies, okay? Intellectual wellness, now, guys, don't be confused about this one. We are learning every day. That is the nature of our specialty. That's not what I'm talking about. That doesn't count. This has to be hobbies. This has to be something outside of our careers that gets us excited. A new skill, a new knowledge that we're learning. Environmental wellness is literally the space around us. Does it help contribute to calm, or does it help contribute to chaos? Does your office look like my office, or does it look like my husband's office, okay? So you have to decide. Now, if I were in his office, I would go cuckoo. But in his office, that is his space, right? That works for him. So think about that. Now, I will say that environmental wellness also has to do with the footprint that we leave on this earth of ours. But for our purposes of conversation today, we're going to talk about our physical space around us. So as you look at those dimensions, in your mind, take stock. Actually, I'm doing pretty well in 6 of these, but 2 of these I could use some work on. Now, don't make the mistake that all of us type A's make and think that optimized physical wellness means you're at the gym every day for an hour and you eat 5 servings of fruits and vegetables every day and you're the perfect weight and you can bench press 250 pounds. That's not what we're talking about here. We're talking about making sure you're tending to it in a way that makes you feel well, right? Social wellness for my millennials in the group does not mean you're out with your buds every Friday, Saturday night. It means that from time to time you're really connecting with people. So don't set your bar too high. We tend to do that. Just take stock and think about the areas that you might need work in. This is a good starting place for building your own personal resilience or guiding others on how to build their personal resilience. And when you lose your way, it's a great place to come back to and say, okay, wait a minute, where am I? Where are the areas that are strong and where are the areas that are weak and what do I need to work on? So lots of data behind the wellness wheel in terms of getting us to that place where we are as resilient and as strong and as ready to respond to the challenges and the stressors of being a physician as we can be. The second overarching concept is born out of literature from Dr. Barbara Friedrichsen at UNC Chapel Hill. And she has been working for decades on burnout, resilience, joy at work, especially in physicians, but just happiness in general. And what she has found is that a lot of our perceived feeling of success in life and our joy in life has to do with how many positive emotions we experience versus how many negative emotions we experience during the day. Now, I know what you're all thinking. We have a lot of negative experiences and emotions running through our days. I get that. And some of us who are completely burnt out are thinking there are no positive emotions, there are no positive moments. And that's absolutely not true. It's about what you're aware of and what you're paying attention to. And so what she has found is she's literally been able to take thousands of participants and thousands of data points and show that folks who have at least 3 positive emotions for every 1 negative emotion they have all the subjective and sort of societal objective measures of success. So they feel better, they experience more joy in their lives, they reach higher levels in their career, they make more money, they have less divorce, they have less physical health problems. Those folks who have less than that, so 2, 1, or no positive emotions for every 1 negative emotion, have all of the opposite. They feel worse, they don't do as well in their careers, they don't do as well in their marriages, they have worse health, they actually go to jail more often, okay? Now, here's a caveat. So before you all run out and get really, really, really happy on me, if you go past 12 positive emotions, so greater than 12 positive emotions, I know it's probably not a risk that we're going to have to face, but if it's greater than 12 positive emotions for every 1 negative emotion, you actually start to slide back down into that maladaptive pattern. And so we know we need some negative emotions. There are roles for fear and sadness and anger in our lives. There are coping mechanisms. And folks who don't use those, the Pollyanna-ish folks, actually become inflexible and they aren't coping as well with stressors. So keep it somewhere between 3 positive emotions and 12 positive emotions for every 1 negative emotion. Now, I don't know about you guys, but I don't walk around with a clipboard and say, wait, yep, that was a positive emotion. No, 2 negative emotions. And then add it up at the end of the day and see what my ratio is. That's not how we work. But what I will teach you to do is be aware of the positive emotions that you're having, harness them, and stockpile them, because that's what builds resilience, right? Now, if I had my slide up here about what burnout is, and Ms. Alexander showed you the 3 components of burnout, one of the other definitions of burnout that comes out of Duke is folks who are in crisis burnout have an inability to feel positive emotions. So if you've ever been there or you've ever known that person, they don't feel positive emotions, right? Like no matter what good happens, they're the one that says, yeah, but, and they find what was wrong in the situation. So this doesn't work for them. If you're mentoring or you are this person, this approach is not going to work, and we have to move back to the wellness wheel approach, right? Until we can get someone feeling better enough that we can begin to work on that skewing of the positive emotions to negative emotions, okay? So those are the 2 biggest concepts around how to build personal resilience that are backed by the evidence. Before I move into talking about specific tools on how to do these things and how you might incorporate them into your work unit as well, I want to kind of go back to the central theme that we've all been discussing here and that I heard, and that is that there is no magic bullet. This is a really, really complicated problem, and absolutely a lot of it has to do with external factors that we don't have a lot of control over. But we do have control over what we do. And we do have control over what our work units do. And this is my special fun area of what I do at work. And this is what I love to do, is go into work units and figure out how we can take individual resilience tools and maybe some systems approaches that we don't scale up to the entire system, because that's the slow boat. That's the one that's going to take a really, really long time and we don't have as much influence over. But how can we do that in the microcosm of a work unit? So I want you to be thinking about it from that perspective, because that may actually make you feel like you do have a little bit more control over some of these bigger systems issues. And then I'll just give you a teaser, because someone asked, well, what are, Don, I think it might have been you, what are the big buckets? Yeah. And everyone in here said EHR, and you know what, I'm with you. It's ridiculous that it takes me longer to document a pap smear than it does to do it. I understand that, but when you look outside of healthcare and you look at organizations that really have this down, that are really doing a good job of promoting joy at work and wellness at work and well-being in their employees, there are 3, they do tons of things, and some of them work, some of them don't, but there are really 3 areas that pop up over and over and over again, and healthcare is starting to do some of this to see, well, wait a minute, will this work for us? And the first one is, and don't laugh, generous staffing. Imagine that. Actually having more people than some consultant or some financial officer told us we should have, right? I think there's this sense that if we have too many people, people are going to be sitting around, and everyone in this room knows there's enough going on in medicine, no one's going to be sitting around. But it offloads, right? It decompresses us. So generous staffing is the first one. The tough one about that takes resources, right? And that's not often what institutions are willing or can do. So that's a tough one. The second one is, and by the way, along with that generous staffing is having the right person in the right job. Because we all know that one person who is skilled and passionate in a particular area can do the work of 10 who are not. And so it's also about where they put folks. The second overarching concept is real and almost mandatory. No one's made it mandatory yet, but highly, highly, highly encouraged rejuvenation time. So real daily rejuvenation time. I think about my ED partners who are working, 8, 10, 12-hour shifts and cramming lunch down their mouths, in between patients. That's not rejuvenation time. And so places that are doing this well are making sure that there is daily, weekly, monthly, and yearly real rejuvenation time. And tied with that is disconnecting because of technology and how accessible we all are now, disconnecting from that. And then the third piece is autonomy. And I bet everybody in here would say, oh yeah, autonomy. Just let me pick how I document for my patients. Just let me pick how flow works in my office. Just let me pick how I'm going to manage my schedule and how I'm going to manage my care team. And so those are the three systems buckets, and I didn't mean to steal from the systems issue, but I just wanted to throw those out as teasers because those have been shown to work outside of healthcare and now beginning to be used in healthcare organizations, and they're really impactful, right? So if you can do that in any way in your work unit, you'll get somewhere. For those of you who are thinking, I feel pretty good, but I really want to help my care team, I want to help my work unit, but I don't know how to get started, here's a quick roadmap. Just follow these instructions, these directions. The first one is models the use of some of the tools we're going to learn today. If you're doing them, as physicians, we are leaders. And people will follow. People will listen to what we have to say, and they'll watch what we're doing. The other one is ask your team, and I actually think this is more important, and this is the best part of what I do when I go into a work unit. Leaders always, whether it's a physician or otherwise, always have an idea of what they think their team needs, and sometimes they're spot on, and sometimes they are so wrong. And so ask the team, and that can be formally through survey tools, it can be informally, but then you find out what the priorities are. You also find people have great ideas about how to fix things if you ask them. So that's the most important instruction here. The next one is what we've been talking about, empower folks to talk about this. It's not in our nature to admit we might feel like we're failing. And we have to understand that burnout really is not a failure. It's a consequence of the system we've built, and we need to talk about that. Maybe you have your team set a wellness goal. I always recommend that it be very, very small, because this isn't about the actual goal. This is about the messaging that you set when you say, we're going to make this a priority, we're going to have a wellness goal. Have people around that champion this for you. You don't want to add to anyone's to-do list, but people who are passionate about this, who could be reminders, cheerleaders, that kind of thing. Keep a library of wellness resources. You need one if you're starting, and it's the website link to the National Academy of Medicine's Collaboration Action Plan. The information on that website is amazing and will help walk you through a lot of this. But if you have other wellness resources, or you want to reach out to me, I'm happy to help you fill that library. And then if you think about any lifestyle change that you had to make yourself or that you asked a patient to make, you know how hard this is. This is culture change we're talking about. So every tiny little step you, someone else in your department, or your work unit makes, show appreciation, celebrate it. It's the same thing we have to do for ourselves when we're making lifestyle changes. We have to reward ourselves and say, gosh, I know I'm not to my goal yet, but I took the right step, I did the right thing. I'm going to celebrate that. And that keeps up momentum and motivation. So there's your blueprint if you want to get started in just your work unit. You can certainly scale this up to your system as well. It's just a little bit harder. So let's talk about some of the tools. How am I doing?
20 minutes.
Oh, sweet. We need several tools. So I've got 10 up here, and this is certainly not even close to an exhaustive list of the resilience tools that are out there. I've chosen these 10 because I live your life. I know how busy you are. If I talk to you about the data behind meditating for an hour and how fantastic it is, there's no way anyone could do that. I get it. If I have time to meditate for an hour, that's a nap. That is not a resilience tool. That is a nap. So I picked 10 that are very easy to incorporate into your lives. Some folks would call them bite-sized. They are evidence-based, so I didn't make any of these up. They all have data to show that they build resilience. And so you say, all right, well, what does that mean? Well, it means 3 things. One, it means people say they feel better. And that's what we're shooting for. We want people to feel better. They respond to stress in a better they have better coping mechanisms. 2, we have biometric data that shows they are responding to stressors better. Their heart rates are lower, their breathing rates are lower. When you check their blood, their cortisol, epinephrine, and growth hormone rates, which are stress hormones, are lower. And when you do PET scans, in some of these cases, not every case, when you do PET scans of folks and you actually do mapping of the neurophysiology that's happening, in many of these tools, you are literally re-hardwiring your brain and the neurohumoral cascade to respond more adaptively to stress. I'm going to say that again. You literally re-hardwire your brain to respond to stress better. So this isn't just, yeah, I said thank you to someone and that makes me feel warm and fuzzy inside. There is that, and we want you to feel warm and fuzzy inside, but you actually make it so that you are a better responder to stress. That's the neuroplasticity definition of resilience. So they really do work. So I've got them kind of bucketed. These first three good things, documenting 3 good things that happened to you in the evening. The second one, a gratitude letter, writing a letter to someone that shows appreciation. And the third one, signature strengths, which is actually a test that helps you identify your 5 top strengths, and then you use that visually and apply that to your work during the day. Those are all very one-and-done kind of exercises. Okay, they usually last about a week, although the gratitude letter is a one-time thing. And you get a benefit somewhere in the neighborhood of 3 to 6 months. For us as physicians, if you're in a healthcare institution that's going through madness, I don't know, 3 to 6 weeks, I don't know. But if you're not, 3 to 6 months, right? But you do it once, and you're done. Very easy to do. You can walk out of the door today and do them. And so if you guys pick one of those, you'll know how to do that today. The next one I call my integrate bucket. And the reason for this is these are not hard things. They're not hard to do. We can very easily figure out how to weave them into our typical daily routine. But you got to think about it. And so I work with folks a lot on cueing, like how we put together one of these resilience tools with something you do all the time, like check your phone or go to the bathroom, right? How do we couple them so that you integrate it into your life? And so random acts of kindness, huge resilience impact, by the way. The biggest spike in resilience than all of the tools. Doesn't last as long, but the biggest immediate spike. MAP it out stands for mindfulness, awareness, presence, and pause. And some of you may be very, very familiar with the emerging literature around mindfulness and just how incredibly impactful it is. In fact, it's probably the newest and most studied modality for resilience and for physicians that's out there right now. And then, of course, physical activity. And this doesn't have to be that hour carved out at the gym. I'm talking about how you incorporate that into the work you're already doing, into your day. And I work with folks all the time, fitting and fitness talks, where we talk about that. And then finally, the last bucket, which takes a little bit more effort, a little bit more investment of time, resources potentially, or it's one of those that we can't just decide, okay, I'm going to go out there and feel some awe right now. It doesn't work that way. Awe and humor are not tangible in that sense. But you have to be open to them. You have to be ready to experience them and then let yourself be present with humor and awe so that you get that resilience building effect, okay? And then mentoring and the 20% rule take a little bit more time and effort and planning on your part. So since we have a good deal of time, I'm hoping maybe we get through 2 or 3 tools today. This is the fun part of the talk. I let you all pick. And so I never know what I'm going to get to talk about, and it's always fun to see what people are interested in. So Eric, you don't get to choose, I'm sorry. But anybody else can choose. And if you don't pick one, if you're too quiet, I talk about physical activity, and nobody wants to talk about physical activity. So somebody better pick. 20% rule. So Dylan, can we click on the 20% rule, please? That's awesome. Okay. So the 20% rule, apparently there's a lot of different 20% rules out there, so you might be thinking of the wrong thing, but let me clarify for you. 20% rule means that if you spend 20% of your time at your job working on what you are really, really passionate about, what gets you really, really, really jazzed, it sort of doesn't matter what the other 80% looks like. Now, when the data around this first came out, I thought, no way. Maybe if you'd said 50-50, I might buy it, but no way it's 20%. And I ignored it. And then more and more and more data came out around this, and I thought, this is outstanding. I have to share this as a resilience tool. And so what happens is, and we'll talk about harmonious versus obsessive passion in a second, but anytime you're working in an area that you're passionate about, you're releasing all your happiness hormones, right? Your dopamine shoots up. But it also, working on your passion also tends to build the skills that will promote you in your career, but also happen to be really important resilience skills, right? So you see here professional growth, engagement with others. There are a few caveats to the 20% rule that make this one tough. First of all, logistics, right? So whoever is our supervisor, our boss, our manager, if you are not the end of that ladder, has to figure out how is that going to look. So especially when I'm working with work units that have folks in lots of different roles, figuring out how we put them into a 20% paradigm can be a little bit difficult, and I'll tell you how we do that in just a second. So logistics can be difficult, thank you. Logistics can be difficult. The second challenge, and this is the one we butt up against most often, is not everyone knows what that means to them. They've either lost it or they never knew what their passion was. And so it takes numerous iterations to actually get there, and that's okay. I can tell you I've had numerous iterations in my life as a physician, and what I do now, working on health and wellness with our team members, is for sure my passion. So I lucked out, but it took me a while to get there. And so figuring out what your passion is tends to be the first roadblock that we have to overcome. So we work with folks, we get them to start writing mission statements for themselves, trying to figure out what 20% of their work time would look like if they were dealing with their passion. They can't decide they're going to knit, okay? It has to be something that's related to their career, but we figure that part out first, and then we start thinking about how we might make that happen logistically for a department, and we unroll that a little bit at a time. The third biggest challenge is if you're really going to work in your passion area, you have to have opportunities for flow. Has anyone heard of flow in this context? Not the type of work my husband does in terms of how we get folks moved through the healthcare system, but that sense of working on something that you're passionate about is a bit of a challenge. It can't be super easy, and you lose track of time. Okay, has anyone ever had that happen before? That's flow. And you have to have that happen if you're really working in your passion. And how many of you have the time and the opportunity to sit uninterrupted and work on your passion on a challenging project and lose track of time? Yeah, not the hand is going up. Well, okay, good, great. There are a couple of hands. Wonderful. But that is obviously a huge challenge in our field, is how do we carve that out, right? And even if you think of it, if you decide, my passion is seeing patients, I absolutely love when I walk in the room and I hear their story and I figure out how I can help them. Think of all the things that EHR is the one that comes to mind, but think of all the things that interrupt that flow. So even if that's your passion, you're not getting the opportunity to get in the flow with that, okay? So that's how the 20% rule works. It's obviously tough because we got to figure out what your passion is, we got to figure out what that would look like on the ground, day to day, in a given week, and then you have to be given those opportunities and those moments for flow. Now, if you do want to try to start sneaking this into your work unit wellness plan, one of the things we start getting folks to do is begin writing those mission and vision statements for themselves. And I don't know if any of you know the One Thing series, and I'm forgetting now who the author is on this, but he has a set of questions and tools that can help you drill down to what it is that is your meaning and your purpose. And so we start with that. Then we start getting folks to think about, well, what would my perfect 20% day look like? when I woke up in the morning and showed up at work and left in the afternoon or evening or night, what would that 20% look like? And then we start letting one or two folks pursue that, one at a time, so that a work unit isn't completely disrupted. And they might do it for a quarter, and then the next one or two might start to build that in, so that the work unit, gradually adopts that. So any questions about the 20% rule? Incredibly impactful, a little bit harder to implement. So do you mind going ahead and clicking on that, Dylan? It's the stop sign. Well, I don't know if it'll go where it's supposed to go. It did, yay. So mindfulness is, map it out as mindfulness, awareness, presence, and pause. So mindfulness is simply being in the present moment without judging what's happening. So it's literally just bringing yourself to the present. Now I put this paper up here because this was the sort of beginning of the work around mindfulness with physicians. And what they were doing, and actually nurses as well, what they did was a series of studies, and I'll try to condense them, but essentially what they found out was that we can handle 3 tasks at once until everything is shot and we have to start over, and we can handle 3 interruptions. 3 interruptions before everything is shot and we have to start all over, okay? So now we know in healthcare that we're handling many, many more than 3 tasks at a time, and we're being interrupted many, many more times than 3. So they started looking at different interventions to help deal with that setting, that kind of environment, and one that popped up was mindfulness. So they taught clinicians some mindfulness techniques. They cued them throughout the day so that they did this maybe once, twice, 3 times a day, every day, and they found over time that these folks had less rates of burnout, they had higher rates of resilience, i.e. they felt better, their biometrics suggested that they respond to stress better. So we know it works, and there has been tons of literature around mindfulness in the healthcare setting, with physicians, nurses, even with patients, care teams. So the question is not does it work, and the question is not how how do we make this happen. It doesn't take a lot of resources. It's really more how do we do it? How do we remember to be mindful? So this is one of those things that we have to cue. We have to couple with something that we do. So maybe it's what you do before you walk in every 5th patient's room. Or maybe it's what you do, you set your alarm on your phone. Or maybe every time you run to the restroom before you get back to work, you take a mindfulness moment. And let me tell you, this stuff is easy. It is so simple to do. Meditation is a very highly refined tool for mindfulness, but there are so many other tools that I'm going to teach you 2 right now so that you can start this today when you walk out the door. The first one is something called 5 senses, and I gotta say, my husband came up with this, this was 15 years ago? We were in Key West and no one wanted to leave because who wants to leave Key West and go back to seeing patients? And we were bummed, and we were standing on the balcony, and Eric said to me, you know what, let's just stop and examine what our 5 senses are doing. Let's just do it. And it's something we have done forever. And man, I wish you had published it because it's a thing, and we could have been famous. Seriously famous. So I'm going to give him kudos, but it's actually not him that gets credit for this. This is in the literature, it's not here. So it's simply exactly what it sounds like. You stop and you look around and you take stock of what you see, what you hear, what you smell, what you feel, feet on the floor, clothes on your body, wind in your hair, and what you taste. And if you don't have something to taste, the alternative is how do you feel emotionally. But I do caution you around that one because, as I said, mindfulness is being present in the moment without judgment. So if you happen to be angry, you need to just say, I'm angry. But a lot of times we'll sort of absorb that emotion, right? So you have to be careful with that paradigm. But it's literally taking stock of your 5 senses. That takes 1 minute. And that is an evidence-based mindfulness tool. The second one is describe the room. So stop and tell yourself, if I had to tell someone who'd never been in this room before what this place looked like, what would I say? How would I describe it? How would I make it so clear to them what this room looks like that they could picture it themselves? Now, you don't have to do it. Don't go tell somebody what the room looks like. That's boring, and that's not part of the exercise. It's just you stopping and sort of thinking to yourself, okay, well, it's, rectangular, and it's this particular dimensions, and these are the colors of the walls, and it had dimmer and then not so dim and then dimmer again lighting. mindful. And doing that on a regular basis, even just once a day, will increase resilience. So that's your mindfulness. Okay? I do whole talks on just how you handle technology, because technology pulls us out of mindfulness and being present all the time. And so that's something else that will pull us out of that. But when you're trying to do this in a work unit, if you round, maybe you try a mindfulness moment with your team, right? Just kind of get them in the habit of doing that. If you have meetings, you can start them with mindfulness moments. What we'll do, you'll see that I always have quarterly activities listed, and that's because often work units meet quarterly for some kind of staff meeting, that sort of thing. And I'll give homework, and so the homework around mindfulness is everyone has to figure out their cue, has to write down, okay, this is when I'm going to be mindful, this is how I'm going to remember to be mindful. Every time I look at my phone, or every time I finish putting a patient back, or that sort of thing. Okay, so that's the intervention there.